Well, John, it's a good question. We monitor this every single day. We're on the phone with local health departments frequently. We're talking to school superintendents. I get emails from different superintendents. In regard to our schools, I think our schools are doing a very good job. They're on this. They're doing the best job that they can. What we're seeing is, our concern was that when we saw outbreak with kids, that would lead to outbreak with older Ohioans. We're seeing that. What we don't know is if there's a cause and effect. We're seeing more from older Ohioans. For a month or so, it's been, a big percentage is under the age of 30. Now we're seeing these numbers go back up with an older population. And so the simplest thing to do is to be able to curtail these events. I mean, I read examples. If we could get 80%, 85% of the people in this state in every county to wear a mask when they're out in public and to avoid these big events, we'd have this thing under control. I mean, it'd still be here, but we would have it under control. And so I know everybody's tired. I'm sick of it. You're sick of it. We're all sick of it. But we got to hang in here. I get the question a lot. Mike, when's this over? When can I take my mask off? When can I go about life as normal? And I don't have a great answer, but the best answer I can come up with is that will happen when we get herd immunity. And as you heard from the discussion that John Husted had in the study that he presented today, we're not going to get that without the vaccine. I mean, we're not going to work our way into this for years. So what we have to do is hang in there. We got to keep this virus low. We got to keep our foot on its neck and wait. And we wait for the vaccine to hit. And when it gets here and the first people start getting the shots, we got to encourage everybody to get one that can. And it's going to come layered. It's going to start with our most vulnerable people in our nursing homes and others. It's going to start with our first responders, and it's going to take a while to get this out. But the point that we get this way, way out, so we've got a significant segment of the population, and I don't know what that segment is, but a significant segment, that have that immunity. If this does in fact work the way we hope it will, then that's when we see the end of this. I mean, look, we're tough. We're Ohioans. We've been at this 7 months or so. And it's not easy, but we just got to keep going or we're going to have these outbreaks. And when we hit the outbreaks, I know this has been tough on business. I know it's been tough on bars. I know it's been tough on restaurants. I know it's been tough on a lot of small businesses. And I know it's been tough on people losing their jobs. And if we're going to have any chance of continuing to grow the economy, then we got to keep our foot on this devil down there. And it can only be by people wearing masks. So the things to do, John, differently, there aren't different things to do. We just got to do what we know we got to do. And if we get those numbers back, I mean, I was on the phone this week with a number of health directors who said, look, our mask compliance was going up. It was great. Now it's starting to go down again. And I get it. People are wore out, but we're Ohioans. We can't get wore out. We got to hang in there. And by hanging in there and doing the things that we need to do, our kids can play sports. Our kids can go to school. We can keep our businesses open. But it's only if we do these other things like wearing the mask and keep a distance. That's where we are.